Welcome to another episode of the Doctor's Podcast with Rabea Akram. This is Rabea Akram. I'm a medical doctor and entrepreneur, and in this podcast, I interview other medical doctors, worldwide leading experts, and I bring you their stories. And today I have a very special guest with me. Her name is Dr. Tesmer. Dr. Tesmer is an award-winning aesthetic medicine specialist with over 37 years of clinical experience. And today we're going to be talking about everything beauty and aesthetics. So stay tuned. So Dr. Tesmer, tell me about your practice in medicine, what you do, aesthetic medicines. What are the type of, beauty treatments that you offer, and what's so special about it?
I am a highly specialized pediatrician. I only practice neonatology, which means that I save babies, being half kilogram or 6 kilograms. Whenever they are born and they are in trouble, that's what I do. Now, I also am a medical aesthetic specialist. I developed my second passion later on in life. For now about 18 years, I'm a proud owner of Visage Laser and Skincare Center. Now, you can easily understand that being an intensive care physician, I like to do intensive skincare. So I utilize everything what we learned over 2,000 years because your listeners need to know that 2,000 years ago, Cleopatra was soaking in milk. Not too many people know it was a sour milk. She probably procrastinated, milk went sour, she was furious, she goes in, she comes out, wow. That is because there is lactic acid in milk, and there's way more lactic acid in the sour milk product. So in Mediterranean countries, they will still put the kefir yogurt for 20 minutes on their face, and what they will experience is super soft and temporary bleached skin. That's because lactic acid has two properties. It dissolves the dead cells, so the skin is super smooth, and it temporarily bleaches. Over 2,000 years, witches and aestheticians and finally doctors decided to mix acid together. And we have a specific combination for Fitzpatrick skin type 1, 2, 3, 4, 5, which helps the person look their best. So that's one thing. Acids are mighty important. Over the years, we learned that if you remove the dead cells, well, the new skin has to grow. So all kinds of microdermal abrasion machines are being used for that purpose. The most important thing in medicine happened more than 60 years ago when the physician who was a dermatologist got a brilliant idea that if this is hair and this is hair follicle, if you put the laser here, you can burn the hair follicle. The person will never have to shave, and he will be a millionaire, and that's exactly what happened, okay? Now, hair grows in stages, so a person will require 5, 10, 15 hair removal procedures every month. What they realized that after second, third procedure, there was definitely less hair, but the skin was looking gorgeous. The pore size were getting smaller, acne was filling, wrinkles were filling up with collagen. So what they learned from studying the process is that the heat which was going to burn the hair follicle spread it to the cells around, warm the water in the cells, and this is enough trigger for the cells to wake up and say, I should be doing something. What was it? Collagen. And it started producing collagen. Now, since then, we learned about all kinds of different devices, how to stimulate those cells from laser, infrared, ultrasound, and even radio frequency, because there is no more powerful thing than when you electrocute the cell. Boy, that gives her reason to work, right? So combination of all devices and combination of acids, all of those, I decide for the patient who come for the consultation, and we can accomplish amazing results with those different procedures.
Right. So the laser part was really interesting, but you were talking about something with radio
frequency. Yes, when you imagine the surface, middle, deep, and very deep layer of the skin, if you Google surgical face lift, people will be able to realize that it's not only cutting and pulling skin up, but what really can you hear me? What plastic surgeons are actually doing, they are electrocuting very deep cells down in a very deep layer, because that stimulates them to production of the collagen. Now, we can deliver radio frequency through the skin and irritate the cells, electrocute them basically, on the surface of the skin, and that's why they get mighty powerful stimulation to produce collagen.
All right. So I was also reading on your biography that you do something with ultrasound. So this would be the same as that?
So this is what happened. About maybe 30 years ago, there was a 40-year-old patient who had a superficial liver tumor, and poor thing couldn't tolerate radiation or chemotherapy. She had 5 kids, and nobody knew how to help her. Someone got a brilliant idea that we know how to destroy the kidney stone with ultrasound. You break them, and the person will pee it out. And the same idea was used to destroy the superficial liver tumor, and it worked. It was a miracle. So it was described in almost every magazine, including plastic surgeons, said, wait a second. To do the surgical facelift, as I told you before, they have to cut the skin, pull the skin down, and on exposed very deep tissue, the liver, there's electrocuted zaps. So they said, if you can get with the ultrasound to the liver, clearly we can get to this very deep layer. So when you utilize ultrasound, you send from the device transducer the ultrasound wave together. They get together, do a zap, kind of like when you were focusing and getting the sun ray through magnifying glass, you just zap, zap, zap. And that is the most powerful device for the lift. So, because when the patient comes, we need to decide what is the most important thing. Is it superficial layer or is it skin laxity? So, depending on what are the issue, I can direct appropriate devices to get the most result.
So in terms of, we talk about, you're using laser therapy, you're using ultrasound to kind of increase the collagen production underneath the, skin layers. What can I do today naturally without using laser? Because not everybody has access to laser or to expensive treatment options. Is there anything that I can do naturally to kind of rejuvenate and to stimulate collagen production?
Okay, absolutely. So let me summarize what a person should be doing at home. Even if they don't have access to laser, they can tremendously improve their skin and rejuvenate themselves, okay? So the first principle is that you have to use sunscreen. Now, there are different sunscreen, and you have to be sure that you're using UVA and UVB. The easiest way to remember is that UVA is aging, and UVA rays from sun we are exposed to through the 12th month of the year. Even here in California, in wintry, rainy day, we are exposed to UVA, right? So that's why important to, even the tinted glass is not going to have. UVB are burning. We are exposed to them more during the sun. So it's very important to use the combination of UVA and UVB. A person can make sure that the sunscreen is good, like we always check the sunscreen our patients are using after ultraviolet light, because it will show you how well it covers, okay? So sunscreen, even on Saturday when you think that you're going to be in your PJ all day, please put the sunscreen, because chances are that you will go to pick up the mail, and that's enough for the sun to damage us, at least here in California. That's one thing. Second thing, wash your face, which appropriate for your skin wash, twice a day. Even in the morning, splashing just the water, it's not enough. So wash your face with appropriate wash twice a day. So that's the second thing which everybody should be using. I've already mentioned to you that all this knowledge we have that acids are good for the skin. Now, depending if you're looking for controlling the acne, that would be glycolic acid. If you want to keep small pore size, prevent the wrinkles, and hold on to the Botox result, you want to use retinoic acid, okay? So different acids for appropriate different stages of life are necessary. And time to time, at least do some kind of microdermabrasion, exfoliation of your skin, so the new skin will be produced. If you obey those rules, I promise you, you will prevent aging by protecting yourself from sunscreen, stimulate the cells to produce collagen with the acids, and you will be very grateful for this information.
Right. Those are really incredible tips. I want to follow up with the UV protection that you talked about. In my personal experience, a lot of the UV sunscreens that I have tried and tested, they tend to clog up the pores, and most of them are very thick in consistency, even the ones that are gel based. Do you have any tips on that?
You know what? Yes, we are using. Can you grab me the elastin sunscreen? So we use here the elastin sunscreen. Over 18 years, I've been trying different. So this is a combination of the physical barrier and chemical action of the sunscreen. We know that to accomplish 50, 80, or 100 SPF protection, you have to use more and more chemistry. However, if you combine the physical barrier by using the zinc oxide and SPF chemical action, you're going, even our sunscreen, which we are using here, I will keep it close. Can you see? It's only 36 SPF, right? You would think that is not enough for California sun, but actually because it has zinc oxide, it's perfect. And I was able to convince pretty much all my patients, instead of using any foundation, that's what they use because it's slightly tinted and it does not plug the pores, and it also doesn't accumulate in the wrinkles and lines, so it gives you this very beautiful appearance. I'm pretty sure you can get it in Europe. It's fantastic, okay?
We're gonna put the links in the descriptions. Yeah. So thank you for that tip. So let's talk about you talked about acids. So is it advisable, because I have tried out so many different products, and I'm one of those people who like to try and test, and I know many people who just buy off the shelf exfoliating chemical exfoliators containing acids. Do you have any concerns with doing this, and what is your tips on doing it right?
So depending of what skin type a person is, Fitzpatrick 1 being the lightest and 5 being the darkest, person has to be very careful when they get to Fitzpatrick skin type 3 and above. This is because the darker the skin, the less forgiving the skin is. And this is misconception. People assume that they can use a lot on the darker skin, where actually you have to be super careful with the acids when you go to the higher level. That's why it's good to be in touch with the skin specialist. What can happen is that if you use too powerful acid for your skin, those acids not only will stimulate cells to produce collagen, but they will affect the cells to produce pigment. So you can end up with hyperpigmentation, which means that you will have a dark spot on your face. So most complicated to treat is actually Asian skin. You would think that Japanese people are as white as me, Caucasian. However, I have to use 80% less of energy when I'm using my devices on Asian skin. So it's not that the darker you are, you can go to town and use everything on the person. Not at all. Most of the time, because my devices are mighty powerful, I prepare the skin by asking the patient to pre-treat before laser procedure with Kojak and hydroquinone. Those are the agents which go to those cells which produce pigment, and they block the enzymes. So the cell is not able to produce any pigment. So anybody skin type 3 and above, I would ask to use the combination of those products for 1 month, twice a day, and then I'm free to do whatever procedure I want to do, except that again, I will be still using much less energy than I'm allowed to do on Caucasian.
Right. So what are those 3 products again? Could you please say that again?
Yes. So I use the combination of hydroquinone and Kojak. I think Kojak is not allowed in Europe, but we do have it here in America. So there are other plant-based products which are bleaching. So bleaching happens because those products go to the cell and prevent the cells from producing pigments. So over the time, the person look lighter, right? So I add to those products salicylic acid because salicylic dissolve the dead cells, and because of that, the other product are able to get deeper. And I always add glycolic acid to that because glycolic acid is the tiniest chemical which can penetrate the skin very easily. And it keeps those same cells which we keep talking about, which we want to stimulate to produce collagen. So the person would be using it twice a day. That's why when you use glycolic acid twice a day, there is no way that your skin will not look better in a month, and probably sooner.
Coming back to, you said that the acids kind of also can stimulate the production of pigments, but in the case of glycolic acid, that would not be the case.
No, glycolic acid, you're fine. I would avoid acid peels, which are great for Caucasian skin. But, whenever an agent is burning the skin, and the superficial layer has to go away, that is the time that, yes, you will get temporary beautiful skin, but you're going to pay for that because it's kind of like sun damage, except that sun damage happens after 40, 50 years of exposure to sun, right? The laser damage or the acid peel damage will happen in half year or a year. So be careful with acids. Ask for advice from your cosmetologist.
So I have also been reading about something called True Sculpt and endermology that you do. Can you please tell us a bit about that?
So there is forever going fight with the fat cells. We don't like them and we try to get rid of them. Occasionally the fat pockets are so stubborn that we use help for other devices. Now, you can, when you think about it, you can freeze the cell or you can cook the cell, and both of those procedures will destroy the fat cells, right? There is a cool sculpting, which is probably popular in Europe as well, which using the cool sculpting, you basically freeze the cell and the cells will break. Now, what does not happen when you do the cool sculpting, the skin tone does not get better. So basically, a person will lose the fat cells, but they will be left with the loose skin. So this was never a good choice for me. I decided to invest in TrueSculpt 3D. So in this device, we use radio frequency and we use heat, and we heat the cells, make them super hot. Additionally, the radio frequency pokes the hole in the fat cells, and over the time, the fat cells is destroyed for good, forever. Now, good thing happened because anytime you use the heat on the skin, you are shrinking fibers. That's one of the ways we use the device, infrared even, for tightening of the skin, right? Because it's heat. Now, if you shrink the fiber, the skin becomes tighter. So TrueSculpt 3D offers you two things. You can get rid of the fat pocket wherever you are interested, on your belly, on your arm, on your thigh. Additionally, the skin is going to become much tighter. So I yet to serve somebody who did this procedure. So that's regarding the destroying of the fat cells, okay? Now, you can also use endomology. This is a device which is increasing the lymphatic drainage, and when we combine both procedures, you can get even faster and more fantastic results because you allow all the destroyed tissue being absorbed and moved from the area faster. So for body shaping, we are using here TrueSculpt 3D and endomology.
All right, love that. So I want to ask you about hair. So skin, hair is kind of also very connected, right? The whole body is one system, and when you have naturally glowing skin, usually the hair would also be healthy. what are your tips for having naturally, healthy hair? And also, like, hair, as we know it, kind of grows in cycles, right? And when the cycle of a hair growth is shortened due to, it can be due to lack of nutrition, it can be due to stress, it can be due to hormonal issues. When that happens, the hair kind of falls off prematurely, right? I know about different kinds of treatments that are possible. Could you please give us a little bit, if this is something that you do, could you please give us a few ideas and options? Otherwise, maybe you could tell some natural ways of, improving that.
I am not a specialist for the hair. However, common sense, and that's what I use, is appropriate diet, a lot of vitamins. The first thing what I would recommend to my patients who are losing hair is start on some zinc supplement, and it works pretty amazing. If you are zinc deficient, you're going to be losing hair. If you've got a right brand of zinc, which your body is absorbing well, after 3 or 4 days of using that, the hair stops falling out. So I learned a long, long time ago, and this is the first thing which I advise. Now we do have Biomopras, which is the product which Lattice, which helps the eyelashes grow, and we use that on eyelashes and on the eyebrow. However, unfortunately, this product does not work on the hair grow well. So appropriate nutrition and good hair product, that's what I'm using, but I'm not a hair specialist. I cannot advise you well on that.
Right. So, any parting advice you want to give for, in general, for being healthy and having beautiful, glowing skin?
Be happy. Because when you're happy, it shows through your face and to your skin. Be happy with yourself, just realize that you are at this moment on this part of your life journey. Try to improve it. If you want to go with changes in your lifestyle, changes in your diet, and watch, if you are in depressed, watch one, comedy movie once a day. Smile, because that definitely does help. I see people who are coming, and when they are tired and depressed, it really shows on their face. So whatever you can do, and I know you cannot control life, but remember, the happiness shows through your skin.
Right. That's a wonderful advice. Thank you so much, Dr. Tesmer, for taking the time out to be on this show. There's so much more that I want to learn from you, because it's just a wealth of knowledge that you bring. 35 years of clinical experience doing this. And I would just love to maybe do a part 2 of this sometime when you have time.
Lovely. Thank you, doctor, very much for the invitation. Okay, we managed. We did it.